Thanks so much for joining me today. I'm Dr. Catherine, a GP, and today is one of my Ask the Expert sessions with consultant gastroenterologist Dr. Gareth Parkes. We'll be talking about your gut bacteria and keeping healthy. Don't forget to hit the subscribe button, ring the bell, like, share and comment, and make sure you watch through to the end to hear his top tips. Gareth, tell us a bit more about our gut bacteria.
So the gut bacteria, or the microbiome, or the microbiota, there are lots of different terms and you might see them in the popular press, is something we've known about for years. We've always known that they're there, but I suspect that most of you don't realise that the microbiota outnumber us by a factor of about 10 to 1. There are about 10 times more bugs in your gut than there are cells in your body. That's how numerous they are, around 100 trillion. And they play an amazing role for the vast majority of us living in harmony with us, in particular doing things like digesting food. So there are certain types of food that we can't digest, but the bugs can break that down and ferment it, and in doing so release nutrients that help nourish us, in particular the lining of the gut. And not only have we been interested recently in their role in gut diseases, so the kinds of things that I look after, but in a whole raft of other areas, as diverse as depression through to Parkinson's, multiple sclerosis, obesity, type 2 diabetes. We think that these bugs within our gut might play a role.
Is there good and bad bacteria? And what happens if you don't have the right balance, Gareth?
There's a huge amount of interest at the moment, Catherine, in the idea and the concept of good bacteria. So most of us have seen probably adverts for probiotics. So these come in all sorts of different forms, from tablets and powders that you can get in a health food shop through to things like yogurts and drinks in the supermarket. And they are chock full of millions or billions of good bacteria. So those are typically bacterial strains of Bifidobacterius and Lactobacilli. And we do know that they can have an anti-inflammatory role within the gut. So they should, in theory, have a health benefit for us, and that can happen in a wide variety of different ways. But probably the most agreed on factor is that they can calm down the body's immune system. They promote tolerance within the body so that we're happy living with all these billions and billions of bacteria. And in certain disease areas, there is definitely evidence that they can be of substantial benefit. In terms of bad bacteria, there are the ones that all of us know about. So if you've ever been on holiday and picked up a tummy bug and had awful traveller's diarrhea, that was almost certainly caused by a bacteria. So that's pretty obvious. So that's a foreign invader, and then your body will eventually kill it and clear it. But there's some interest in that could, for some of us, have a sort of colony of bugs within our gut that are less good for us and that could lead to kind of harmful diseases such as Crohn's, colitis, potentially even things like diabetes and obesity. And there's been a lot of research on that. Again, it centers around the interaction between these bugs and the body's immune system. They tend to be more pro-inflammatory, so they stimulate the body's immune system, which then ends up sort of attacking either systemically or it's upregulated, we call it, and could attack the gut. So there's a huge amount of interest, but at the moment we're really at the beginning of our discovery into this. And so translating these findings into useful treatments, which is what most of us would care about, we're really at I suppose, the infancy of.
How do you know if you have a problem with your gut bacteria? And what can help you to help yourself and your gut get more good bacteria, Gareth?
There are plenty of ways in which we can try and help our bodies through our gut and our digestive system. And through that, we'll probably help our bacteria as well. I mean, the key simple thing is that the kind of advice which all of us have probably been given. So plenty of exercise, a really good, balanced, healthy diet that's high in fiber, low in refined foods and refined sugars, low in fat, with plenty of fruit and veg, and the advice of 5 a day still stands, and not doing things like smoking. So those are sort of common factors which will improve our gut health. But there are some more specific things we can do if we're particularly interested in targeting our gut microbiota. So the first is we can give them almost fertilizer. We can give them foods which they particularly love, and in particular that the kind of anti-inflammatory bacteria, the good bacteria, love more than others. And these are called prebiotics. You can find them naturally in quite large amounts in slightly stranger foods. So chicory and Jerusalem artichokes are chock full of these prebiotics, or you can buy them as a powder or as a food supplement. And they help grow up the natural good bacteria that we have inside us. And you might find some health foods have those as an additional benefit attached to it. Then you can take probiotics. So that's a slightly more direct approach. Now you're bringing in those good bacteria, and we've already talked about those a little bit already. If you're completely fit and well, there isn't a huge amount of evidence they do benefit, but they have been shown to help in prevent things like diarrhea. In certain disease areas, they have been shown to be a benefit as well. You can take slightly more radical approaches, courses of antibiotics, but multiple courses of antibiotics are really not a great idea, especially if you're fit and well. And unfortunately, if you take a course of antibiotics, that's fine if you've got a really horrible pathogen inside you, so that's a disease-causing bacteria. But if it's just a more chronic problem, the gut will often, once you finish those antibiotics, it will just go exactly back to where it was before. So it's not a great idea to take on a regular basis. You can take the hugely radical step of actually completely recolonizing the gut. And we do this now in one or two conditions, and we're looking lots of research in different areas. And this is called fecal microbiota transplant. So this is where we first eradicate the natural bugs inside us with antibiotics. We then clear them out with powerful laxatives. And then we place, either by putting a tube through the nose and down into the gut, or going up with a camera, we replace the bugs that were in your gut with someone else's. So we take a fit, healthy donor who's been really carefully screened for all sorts of nasty pathogens, plus any other inheritable diseases. And we take a stool sample of those that gets liquefied and processed until it's a kind of liquid slurry. I can tell you it's a bit disgusting, but it looks a lot like a latte or a frappe. And then we inject that into the donor's gut. And this treatment has revolutionized the treatment of something called recurrent C. difficile infection. This was one of the hospital's superbugs, and an unfortunate bunch of patients would get this again and again, often frail, often elderly. And fecal microbiota transplant, or FMT, has been found to be hugely superior to just bashing on with more and more antibiotics. So it's a really exciting area, and there are trials in all sorts of areas, such as obesity and type 2 diabetes. Can you, by giving someone else's microbiome and someone else's metabolic system, can you change all sorts of disease outcomes? So watch this space, and hopefully in the next 10 years, we'll know a lot more about this.
Thanks, Gareth. That's great to hear about our gut bacteria. Have you got any final take-home messages?
If I were to have 3 take-home messages, the first is, please, please, please don't do as one of my patients did and try fecal microbiota transplants at home. That is definitely something for a research setting in the vast majority of cases at the moment. If we want to nourish and think about our gut microbiota, then please just really healthy, balanced diet, regular exercise, all of which will do a lot of good for your gut. And you can definitely supplement your own diet with prebiotics and take an exogenous probiotic as well. And that certainly will do no harm and may well do some good.
Thanks, Gareth. That's fascinating hearing about our gut bacteria and how we can help keep our gut healthy. For more detail on understanding your gut, take a look at another session with Gareth and I talking about symptoms when you may need to see a doctor or COVID-19 gut symptoms. In the meantime, don't forget to hit the subscribe button, ring the bell, like, share and comment. I'm Dr. Catherine saying goodbye and keep healthy.